Welcome to the Real News Network. I'm Sharmini Pires, coming to you from Baltimore. The U.S. leads the world in child obesity. The Center for Disease Control, CDC, considers obesity to be an epidemic and warns that children's obesity has quadrupled in the last 30 years. A new report on child obesity found that although the rate of obesity seems to have stabilized, it has stabilized at a very high level, and urgent action is needed to improve the health of children in the United States. The report, titled Advancing Equitable Approaches to Childhood Obesity Prevention by Peter S. Arno, is our discussion today. He's joining us from New York, and Peter is a health economist and a distinguished fellow at the City University of New York. His 1992 book, Against the Odds, The Story of AIDS, Drugs, Development, Politics, and Profits, was nominated for a Pulitzer Prize. Dr. Arno's recent work includes studies on the impact of Social Security and the earned income tax credits on the health of the population, as well as geographic determinants of obesity. Thanks for joining us today, Peter.
Thank you. It's a pleasure to be here.
So, Peter, the problem of childhood obesity, it's not a secret. It's plain to us when we walk around theme parks or at the local public swimming pool. It also became the key issue that Michelle Obama worked on at the White House. So where are we at now? What's the status of it?
Well, today, according to the most authoritative studies, there are approximately 13 million obese children and adolescents, which is about 17% of all children between the age of 2 and 19. But there is also troubling evidence that the socioeconomic and racial and ethnic disparities exist in these obesity rates, and in fact, they may be widening. The obesity rates are higher among Hispanics and non-Hispanic blacks than they are among whites, for example. So the epidemic may have stabilized, and it's a little too early to tell, but as you said, it's at a very, very high level. And one of the issues I think we need to always understand about childhood obesity is that these children, when they grow to be adults, bring that obesity with them and present a whole range of public health and personal health issues as people age. So this epidemic, is what's led to the epidemic of diabetes, for example. And so it's a serious problem that we are going to be facing for decades to come.
Right. And in your report, you examine obesity and segregated neighborhoods. So what is the connection between race and obesity?
Well, as I said, there are disparities that exist in the obesity rates by both racial and ethnic groups and by socioeconomic characteristics. And this is not unique to obesity. This is true for a whole range, in fact, most of the health burdens that we face in this country and elsewhere do fall along these socioeconomic and racial gradients. And so when you take a community that has a neighborhood deprivation or residential segregation, these are areas where people live that their choices are constrained by their environments. They don't have access to, or they have poorer access to fresh fruits and vegetables. They have poorer access to places to safely engage in physical activity. So it's part of the entire social gradient in health in general that we see here in the obesity epidemic.
And Peter, what's causing it? What are the indicators?
Well, I think it's a complex issue with many factors. But I'd like to just point out that in our study, where we reviewed hundreds and hundreds of studies over the last decade on the causes and the interventions available to reduce obesity, particularly in children. What we found is that the bulk of the studies focus on individuals or their families as a target, as the primary unit of intervention, and I think that we need to focus more on the policies that generate the conditions that constrain these people's choices. So, to be a little bit flip, the anti-obesity movement, if you will, has been very big, and the private philanthropies have been very big on building bike paths and pedestrian walkways and improving access to parks and supermarkets and all amenities that any community might favor. But these alone are unlikely to curb the obesity epidemic unless we address some of the underlying social determinants of health, such as poverty, income, neighborhood deprivation, and the political economy of our industrial food system. That's where the heart of the epidemic is.
Is some of this to be regulated? For example, the new Trump administration that's coming in Washington has said one of the things it'll do is actually deregulate some of the strict regulations that are in place for school lunches, for example. Do you think regulation will play or should play arm? And are we at risk of furthering or making the situation worse?
Unquestionably, because, the regulations that we have to date are pretty, at least in terms of food production. And you mentioned the school lunch program, which is administered by the United States Department of Agriculture. This is a program that, although it's beginning to change over the last few years, it's still a program that was basically designed to, yes, provide school lunches, but it was also designed to help agricultural producers. And as a result, the kinds of subsidies that agricultural policy has produced have played a pivotal role. So, for example, there are subsidies for crops like corn and soybeans. And when these are transformed into corn syrup and oils, these are the key ingredients to processed, refined, and calorie-dense foods and beverages. And when they drive down the prices by subsidizing these crops, this is our agricultural policies, that creates a food environment in which energy-dense foods become more affordable and increasingly represent a large portion of the overall caloric intake. And that is part of that's a big part of the story of why we've seen this epidemic over the last 20 years. So yes, reducing regulations like this or giving them freer run, and over the past 5 years, there's been a lot of attention to improving school lunch programs. If that gets turned back, that would be disastrous for curbing the obesity epidemic among kids.
And give us some sense of what the research into this problem is like. What are the limitations in research that you came across in doing your own study?
Well, it was really an eye-opener for me. I mean, I've been a researcher myself for the last 25 years, but when we did this very expansive annotated literature review, and our focus was on what's called systematic data reviews, where they meet certain criteria and they review a number of studies to try to see, does a school-based intervention work or does a community-based intervention work, and so on and so forth. The studies were pretty weak across the board. A lot of the attention on these community-based and school-based programs provided very, very weak and contradictory evidence on programs that can reduce obesity. Now, part of this, it doesn't mean that these interventions don't necessarily work, but it means that the science that's applied to these studies is weak. And that's a problem that faces all kind of interventional research. But I think the most promising areas has to do with policy-related proposals, which were based not so much on intervention studies, but on modeling studies, which were based on actual data. So, for example, we know that that advertising that's focused on kids, where they advertise junk food for children, we know that if that is reduced, that would reduce consumption of junk food by kids. So one proposal is to eliminate tax subsidies for television advertising of unhealthy food that's directed at kids. Another area where they did show
what
some...
kind of advertising subsidies exist when it comes to...
Well, they're allowed to take it all. The expenditures on advertising are business expenditures, which are deducted from corporate taxes. And because of First Amendment issues, we have a lot of difficulty in curbing advertisements directly. But one way around First Amendment constraints is to disallow these the subsidies and the tax deductions for this junk food advertising. But another one, which is and where there is some solid evidence, is that subsidies, when provided for fruits and vegetables, particularly in schools, where in some programs and some experimental studies were done where they provided fruits and vegetables for free, they found that reducity was reduced. Another policy is imposing sugar-sweetened beverage taxes. Now, this is a hot political issue, and it remains controversial because many people don't like the quote-unquote nanny state to tell us what we can or cannot eat. But it's useful to learn from the history of the tobacco epidemic and the smoking epidemic that it was the taxes on cigarette products that were one of the major mechanisms that reduced cigarette smoking and prevented cigarette smoking among young people. So there are a few policies like that. The other...
There's that. And what other promising policies or approaches exist to reducing childhood obesity?
Well, the last one I would mention, which relates to subsidizing fresh fruits and vegetables, is to promote in the schools increased physical education time and improve nutrition in the schools. That the evidence is there. It's strong. The effect size is not huge, but there's clear evidence that if kids are given more time to exercise during the school day and are given better meals at school, that they could reduce their obesity.
Where do we see that? Are there some examples you could point to that where...
There have been a couple of very sophisticated randomized case control type studies done by the Department of Agriculture where they have the best ones that I recall off the top of my head is studies that were done in schools where they made fresh fruit and vegetables available completely free to all children. And they compared that to, comparable schools with comparable child populations. And they looked at, they actually measured, how much of the food was consumed, and they measured their weight gains or losses, and they found that this was an effective mechanism. So these are the kind of areas that I think show promise for the future. But so much there's been so much effort that's gone into very elaborate, expensive, and sophisticated community-based models that affect, the adults, the children, the schools. These, there is some efficacy there too, but they're hugely expensive, and it's difficult for interventions like that to be maintained in the long run. The kind of policy interventions that I'm talking about the tax subsidies or getting rid of advertising junk food to kids, these are relatively low cost items, and some of them even have evidence of cost savings that would, I think, would have a bigger impact on A, reducing obesity, and B, reducing the disparities between the poor and the middle class and the wealthy in terms of their weight profiles, because they're cheaper, they can be sustained for a longer period of time, and the evidence base is strong. Some of these community-based interventions, very expensive, and the evidence base is quite weak.
So. All right, Peter, very interesting topic. I hope you go on the road with this one, because our children can really benefit from what some of your
our
findings.
Study is up on our on the Perry website, so if anybody wants to check it out, it's freely available for anyone to view.
We'll put a link to it right below this interview. Thank you so much, Peter.
I thank you very much. Appreciate it.
And thank you for joining us on the Real News Network.